Hi, Kevin Henry, the Group Editorial Director for UBM Advanced Stars Dental Division, and I'm on a Google Hangout today with Dayna Johnson. Dayna is the founder of Ray Dental Management. She's a dental consultant. She is a certified Dentrix trainer, and she's also hosting a webinar for us in late March on your path to a paperless practice. How are you today?
I'm doing great. How are you, Kevin?
All good. All good. So I know you and I have talked, and paperless is one of your passions. And you tell me why. Why is a paperless practice a very important thing in today's age?
Well, it's interesting because when I became a certified Dentrix trainer, I was going out and doing a lot of Dentrix training. But one thing that practices were always asking me was, we know we have to go paperless. We have this deadline coming up. And can you help us? And I still, to this day, that's probably one of the most frequently asked questions I get is, the doctors want to go paperless, or we're being forced to going paperless, and can you help us? And so it just became part of who I was. And then it's so fun. It's a journey that I take with the practices. So it's just become part of who I am.
So the webinar is called Path to a Paperless Practice. So what are some of those steps that you're going to be talking about during this webinar that can help our viewers go down that path with you?
So there's definitely some steps that you need to take. The first step that we're going to talk about is assessment. We'll talk about goal setting, goal and planning, because you definitely want to look at where you are right now and what do you need to take you to paperless? What kind of equipment do you need? Is your practice management software going to get you there? Is your design of your practice even going to allow you to go paperless? So we look at those things. We look at some of the regulations, like HIPAA regulations. Are you compliant with HIPAA? When patients are going to be filling out online forms, do you have all the infrastructure in place? And then we look at a timeline. So I'm going to give you a timeline to help you map out your own path to paperless. A lot of times when I'm working with a practice, they might have a piece of it already in place and they're just looking for the final steps. And so every office is kind of in a different section of the path to paperless. So I give you a timeline that really helps kind of organize it for you.
So what are some of the main reasons that you've heard of why dental offices maybe are a little hesitant to go down this path?
There are several. When I'm teaching a course, a live course with an audience, we kind of go through some of those things. I'll reach out to the audience and ask them, you know, why is your office not paperless yet? And I get lots of answers. Cost involved. A lot of times there's infrastructure or hardware that needs to be purchased in order to go down the path to paperless. The doctors, security, they're questioning the security of their firewall or their internet settings or things like that. So a lot of it is security. Maybe you just have a turnover in team, so maybe you just want to get the team trained in the office before you go down that path to paperless. So there's always lots of different reasons why offices aren't ready to go down that journey yet.
And tell me, I know seems like a constant point of confusion is paperless versus chartless, and
Yes.
kind of tell me the difference and why that's so confusing to people.
So chartless is that you don't pull this paper chart out of the file cabinet anymore, and you're writing all your notes in the computer. You are your clinical documentation is going in the computer. All the insurance and everything is going through the computer. But you're not paperless because you're still using paper forms. So patients still walk into the office and they're filling out a paper health history, or they're filling out a paper new patient registration form. You're still using paper for consent forms. You're still printing a lot of paper reports, and you're scanning a lot of that information into the computer. That's not paperless. So even though you are not saving any paper, you're not truly paperless unless you have gone electronic with your correspondence with your patients, with your forms, with your any kind of communication with your patients. If you're still using paper, you're not truly paperless. You're only chartless.
So again, this is Dayna Johnson, and she'll be leading the Path to a Paperless Practice in late March, a webinar sponsored by Henry Schein Practice Solutions. And you can get more information about it here in the trigger article that we'll be discussing. And Dayna, good luck with the webinar, and looking forward to hearing more about it when you speak.
Thank you. I'm looking forward to it too.